Nick Rosencutter from Rosencutter Ultra Fitness here. This is going to be the first video in our exercise anatomy series. Had a lot of requests to do this, so we're finally going to do it. So exercise we're using today is called a face pull. Jake, go ahead and do a couple of reps there. And plenty of people have seen face pulls, but I don't think many people actually understand the reason why they're so good for shoulder health. So I think these days, at least a decent amount of people understand the importance of at least balancing out pushing and pulling exercises. So rather than doing all bench presses and all kinds of presses known to man, at least people try to balance it out with some kind of row or pulling motion these days. At least I like to think so. What people still don't understand is the concept of scapular balance. So while your typical push-pull exercise at least balance out front to back, our scapula also needs to be balanced out in both upward and downward rotation. So when Jake does a face pull, his scapula is in a state of upward rotation. We put that back once. And just show me just a basic shoulder flexion motion, like with your arm. So anytime you move your arm overhead like that, our scapula needs to rotate up along with the rest of our shoulder joint. So when we do a horizontal row, we are pulling in a state of downward rotation. So our rhomboid muscles, which run from the inside of our scapula to our spine, are going to be the most dominant mover of our scapula in that exercise. So what happens is between horizontal rows and all kinds of bench presses, our rhomboids become very dominant over our mid and lower trapezius muscles. So you look at your trapezius, your mid and low trapezius muscles along with your rhomboids are going to be the two prime movers anytime you pull your scapula back in a pulling motion. So when he does a row, do that again. So when he's going horizontal, our rhomboid is going to be the main player in that activity. But when we do a face pull, we go in a state of upward rotation of our scapula, and our mid and low traps become much more dominant with that pull, since our rhomboid can't do as much because of the upward rotation of the scapula. So if you look at your trapezius muscles, relax your arms once, straight your sides. So you have our upper traps, which most people know about. When you say traps, that's what people usually tend to think about, which branch off of our neck here, sit on top of the rest of our shoulder girdle. But people don't realize is our trapezius muscle travels all the way down to our lowest rib, our 12th rib down here. We have our lower traps that are angled down this way with their fibers. As you come up, your mid traps are angled more horizontally with their fibers. Your upper traps angle up in this region here. So within the one muscle, we essentially have three different muscles within the one muscle that have different functions depending on what you're doing. So when we do a face pull, we get those mid and low traps to engage with that retraction of our scapula, and the rhomboid can't exert its dominance like it can when we're down here in this horizontal pull position. So really important to balance out upward and downward rotation of our scapula in addition to just your typical pushing and pulling. And as an added benefit, do a couple more reps of that face pull, Jake. As an added benefit, he also gets a little bit of external rotation, which is also very important for shoulder health, as most exercises we do and activities we do as human beings promote internal rotation of the shoulder joint. So you have a lot of good things going on with the face pull that can help promote shoulder health as well as build upper back and rotator cuff strength.